You mentioned osteoporosis there. And one of the classic things a lot of people are doing prevention-wise for that is taking calcium.
Yes.
You're not a fan. Explain why.
Numerous cardiac studies have shown that elemental calcium supplements actually increases coronary artery disease. You see, look at your food today. Everything is calcium fortified. Everything's, even your orange juice has calcium in it. And yet, look at the epidemic of osteopenia. I live in Florida, and all the young women that come see me in their 30s all have osteopenia, and we have sun all the time. What's going on? What's going on is calcium's not the problem. The problem is they're not absorbing the calcium. The calcium in the diet is enough. The calcium gets inside your gut, but doesn't get absorbed because the absorption is related to vitamin D3. And we have an epidemic of D3 deficiency because our food is so neutropenic. It doesn't have any nutritional value in it. There's so little vitamin D3 in our food nowadays. So we don't get enough vitamin D3. That's why, look, when we went on this low-fat this and low-fat that diet, look what happened. We stopped absorbing fat-soluble vitamins. Vitamin A, D, E, K. And you know how hard it is for me to tell my patients that they need to increase the fat intake. And instead of drinking skim milk, they should be drinking whole milk. You know how hard it is for me to do that? And the lack of fat means they're not absorbing A, D, E, and K, including K2. So are we surprised that there's an epidemic of osteopenia? Of course. Now, exercise is important and resistance exercises are important to maintain positive calcium balance inside your muscles. But the other thing that is your diet. You need D3. And the other thing you need is K2. So D3 will absorb the calcium and K2 will put it into the right places, which is in the bone. So you don't get non-osseous calcification. So I like K2 because it boosts the movement of calcium into the bones. And for me, that's important because coronary calcification is not a good idea. That's ossification of a non-osseous structure, and I don't want that. So D3 is very important for me for multiple reasons. It's not just for bone health, but vitamin D3 is also involved in over 350 chemical reactions in the body, including to maintain your immune system, gut health. There's so many benefits with D3. So I encourage D3 at least 5,000 units a day. And better still, you should measure your vitamin D levels. You must measure it. Now, the government says anything over 30 is okay. And through experience and the reading that I do, I think it should be more like 60, between 60 and probably 100. That's where I want my vitamin D levels. So that's something I can measure. Vitamin K2, I don't measure. I can't measure. I just give them a pill to take. But when you're eating a lot of fermented food, for example, your kefir, you're going to get some K2 there too. But don't rely on that. Just get the combination D3, K2 combination pill. I like that. Bone health is very, very important. When you put pressure on a bone and you kind of bend it like that, it sets up an electric current inside the bone because it's piezo crystal, really. And when you do that, it forces deposition of calcium into the bones. That's why you have to do resistance exercises. Everyone must, because then you get stronger bones. Get some sunshine. Take D3. K2. Don't take calcium. Elemental calcium. Not a good idea. Look, we've been doing that actually. Why are we even talking about it? When for the last 40 years, we've been advising all the women to take calcium supplements. Have we not? We've been telling all the women, yes, take calcium this, calcium that. And it's a multi-million-dollar business. And what did it do to osteopenic rates? Did they improve? No, they got worse. They got worse and worse and worse and worse. There was no drastic improvement in bone density because people started taking elemental calcium. So it's not a good idea. Not a good idea. Don't like that at all. Now, the vitamins that you should take are these, and you should also take a good general multivitamin. I'm not against that at all. A good general multivitamin. Just because, look, as I said, I don't have holes in my tongue for capsules, but our food is neutropenic. It just doesn't have as much nutrition as before. One of them is magnesium. Our soils are magnesium depleted. Our vegetables don't have enough magnesium in them. Our bodies don't have enough magnesium. And when you measure your magnesium level, it's not measuring intracellular magnesium. All of us need magnesium supplements. Magnesium is important for me as a cardiologist because I know that the electrophysiological properties of conduction tissues in the heart are very importantly controlled by their magnesium levels as well. So it affects your cell membrane potential. Magnesium is very, very important. So everyone should be on some form of magnesium supplement unless you have chronic renal failure. Yeah? Chronic renal failure patients tend to have higher magnesium, and you shouldn't take that. But otherwise, you should take a magnesium supplement. And you can take it as a pill form, or you can put it on your skin as a spray. By the way, that's why I love going to Daytona Beach, right? Why? Because I get into the ocean. Why do I feel so good after bathing myself in the ocean water? Because the ocean water has a lot of magnesium and it gets absorbed through my skin. There's so many benefits by going to the beach, by the way, even from the cardiac standpoint. So my magnesium's better, so my heart is going to be working better. But also the microbiome. Go to the ocean, and every breath that you take will have droplets of ocean water coming in. It's just full of different bacteria. We're supposed to be exchanging bacteria with our environment. When I go out to walk in the forest, the microbiome from the trees is in the air, and I'm inhaling it. So again, I'm replenishing good species, bad species. I'm exchanging with the environment, not just oxygen, nitrogen, the way we all. No, you're exchanging parts of nature coming into you. I'm having live bacteria coming in and it's going to my gut microbiome. Because it comes here, I swallow it, goes down into my gut. And it gets through my ears, my nose, my microbiome, all over my body changes when I go to the beach. Plus, of course, I get the sun, and then plus I get earthing, and we can talk about all those things. But there you go. So go to the beach. Go to the beach. Walk on the sand. And get a little bit of sunshine, not too much, and swim in the ocean water is wonderful.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
The king of all hormesis is fasting. Doing time-restricted feeding on a daily basis should become part of your life. Stop snacking. It's unnatural. You should only have 2 meals a day in a 6-hour interval.